HIV/AIDS is a viral disease that weakens the immune system, leaving the body vulnerable to infections. The human immunodeficiency virus, HIV, attacks essential cells of the immune system, diminishing its ability to fight off diseases. When HIV is left untreated, it can progress to AIDS, acquired immunodeficiency syndrome, the most advanced stage of the disease. Transmitted primarily through unprotected sexual contact via bodily fluids such as blood, semen, and vaginal secretions, it can also be transmitted through needles or from mother to child during pregnancy, childbirth, or breastfeeding. Symptoms of AIDS include weight loss, fever, and severe infections. Since the beginning of the epidemic until the year 2022, approximately 40 million people worldwide have died due to AIDS. Annual mortality has varied over the years, reaching its peak in the 2000s, but has significantly decreased due to access to effective antiretroviral treatments. However, HIV/AIDS still poses a major global public health challenge, requiring ongoing efforts in prevention, treatment, and awareness. While there is no cure for HIV/AIDS, antiretroviral drugs can control the virus and help people live healthy lives for many years. Ebola is a severe viral disease that causes hemorrhagic fever affecting humans and primates. Transmitted through direct contact with blood, bodily fluids, or tissues of infected individuals or animals, the Ebola virus can result in severe organ damage and internal bleeding. Beginning with flu-like symptoms, the disease includes fever, muscle aches, headache, and weakness, followed by vomiting, diarrhea, and in some cases, internal and external hemorrhaging, leading to death in extreme cases. Since its discovery, sporadic outbreaks of Ebola have occurred mainly in Africa, causing devastation in affected communities, with its mortality rate ranging from 25% to 90%. Prevention involves rigorous infection control measures, isolation of suspected cases, and vaccine development. While there is no specific cure, Ebola remains a public health concern, requiring swift response and international cooperation. Rabies is a severe viral disease that affects mammals, including humans. Mainly transmitted through the bite or scratch of an infected animal, the rabies virus attacks the central nervous system, causing inflammation and brain damage. Initial symptoms may include fever, headache, and general discomfort, followed by agitation, hallucinations, and muscle spasms. As the disease progresses, paralysis and coma may occur, resulting in almost inevitable death. Rabies is a global threat, with outbreaks occurring in various regions of the world, especially in areas where pet vaccination is not widespread. Prevention is critical and involves measures such as pet vaccination, avoiding close contact with wild animals, and seeking immediate treatment after potential exposure. While there is no cure once symptoms develop, pre- and post-exposure vaccination can prevent rabies in humans if administered soon after virus exposure. Smallpox was a highly contagious viral disease, globally eradicated in 1980 after a mass vaccination campaign. Transmitted by the variola virus, smallpox presented symptoms such as fever, malaise, headache, and later severe skin rashes that evolved into fluid-filled pustules. These pustules resulted in permanent scars and, in severe cases, could lead to blindness or even death. Before eradication, smallpox caused millions of deaths worldwide. Prevention was achieved through widespread vaccination, resulting in the end of virus transmission. Swift detection of cases, patient isolation, and vaccination in response to outbreaks were crucial for controlling the disease's spread. While smallpox is no longer a current public health concern due to its eradication, its study remains important for understanding the history of medicine and successful public health efforts. COVID-19 is a respiratory illness caused by the SARS-CoV-2 virus, first discovered in China in 2019. Transmitted mainly through respiratory droplets from infected people, the virus can cause a variety of symptoms, including fever, cough, difficulty breathing, fatigue, and loss of taste or smell. In severe cases, it can lead to complications such as pneumonia and organ failure, especially in the elderly and people with underlying medical conditions. Since its emergence, COVID-19 has caused millions of deaths worldwide and had a significant impact on public health and the global economy. Prevention involves measures such as social distancing, wearing face masks, frequent hand washing, and mass vaccination. International cooperation and rapid response from healthcare systems have been essential in controlling the virus's spread and mitigating its effects. Influenza, more commonly known as the flu, is a contagious viral illness that affects the respiratory system. Transmitted through direct contact with respiratory droplets from infected people, the flu can cause a variety of symptoms, including fever, chills, muscle aches, headache, and fatigue. In more severe cases, it can lead to complications such as pneumonia and even death, especially in high-risk groups such as the elderly and people with underlying medical conditions. Seasonal flu causes annual outbreaks worldwide, resulting in millions of cases and deaths. Prevention involves annual vaccination, practicing good hygiene such as frequent hand washing and social distancing during outbreaks. While there is no specific cure, symptomatic treatment and rest are generally recommended to alleviate flu symptoms. The Spanish flu, caused by the H1N1 influenza virus, was a global pandemic in 1918, resulting in millions of deaths worldwide. Transmitted through the air via respiratory droplets, the flu affected people of all ages, causing severe symptoms such as fever, cough, muscle aches, and difficulty breathing. The mortality rate varied, especially affecting healthy young adults. The rapid spread of the disease was facilitated by the lack of effective treatments and crowded living conditions during World War I. After a devastating period, the pandemic eventually subsided, leaving important lessons about the importance of global surveillance and vaccine development. The study of the Spanish flu continues to influence pandemic response strategies to this day. Marburg is a virus that causes the viral disease known as Marburg hemorrhagic fever. Similar to Ebola, Marburg weakens the immune system, leaving the body vulnerable to severe infections. Transmitted through direct contact with blood, bodily secretions, or tissues from infected people, it can result in severe organ damage and internal bleeding. Symptoms include fever, muscle aches, headache, and weakness, followed by vomiting, diarrhea, and in extreme cases, severe hemorrhaging. Since its discovery, sporadic outbreaks of Marburg have occurred mainly in Africa, causing devastation. While there is no specific cure, rigorous infection control measures, isolation of suspected cases, and vaccine research are essential to prevent its spread. Hantavirus is a type of virus transmitted by rodents, such as rats and mice. It can cause a severe illness called hantavirus pulmonary syndrome, HPS, which affects the lungs and can be fatal in severe cases. Transmission occurs mainly through inhaling dust or aerosols contaminated with urine, feces, or saliva from infected rodents. Initial symptoms include fever, muscle aches, headache, and fatigue, which can progress to respiratory distress and other respiratory problems. There is no specific treatment for HPS, so prevention is crucial. Since its identification, sporadic outbreaks of hantavirus have occurred worldwide. Prevention involves measures such as avoiding rodent-infested areas, keeping environments clean and ventilated, and using protective equipment when handling potentially contaminated materials. Dengue is a viral disease transmitted mainly by the bite of the Aedes aegypti mosquito. The dengue virus infects the body's cells, causing symptoms such as high fever, muscle and joint pains, headache, and skin rashes. In severe cases, it can lead to complications such as bleeding and shock, potentially being fatal. Preventing dengue involves measures such as eliminating mosquito breeding sites, using repellents, and installing screens on windows. Despite control efforts, dengue remains a major public health challenge in many tropical and subtropical regions, affecting millions of people annually. Treatment for dengue is mainly symptomatic, with rest and adequate hydration, but prevention is crucial to reduce its incidence and impact on public health. We invite you to subscribe to our channel to continue receiving informative content like this. Leave your like and share so that more people have access to essential information. Thank you for being part of this journey. Thank you for being part.